Good evening, everyone. Today's topic for presentation is Optics of Slit Lamp and Examination. I'm Dr.Simi Mary George, Secondary DNB first year. My session is being moderated by Dr. SVI ma'am. I welcome ma'am to this session. Introduction. Slit lamp biomicroscope is a most common, essential, and comprehensive ophthalmic equipment. As the abbreviation stands for SLIT, stereoscopic, low power microscope with a high intensity illumination to view the details of the living eye. It also uses accessory devices. When it comes to the history, in 1911, Alvar Gullstrand invented the predecessor of modern slit lamp, and Mavers in 1925 coined the term biomicroscopy. Basically, there are two types of slit lamp, Hag-Street type and the C's type. As you can see, in the Hag-Street type, the illumination unit is above the observation unit. And in C's type, the illumination unit is below the observation unit. And both these systems uses different types of magnification systems. Parts of a slit lamp consist of observation system, illumination system, and mechanical support system. Observation system. It consists of objective lenses, basically two planar convex lenses of plus 22 diopter power. And the convex surfaces oppose each other. And next is the eyepiece lenses of plus 10 diopter power. And they are converged at an angle of 10 to 15 degree for stereopsis, for good stereopsis. And we have two prisms and magnification systems. Next is the illumination system. It consists of light source, halogen bulb, LED, and the condenser lenses, and slit and diaphragm, filters, projection lenses, reflecting mirror or prisms. Mechanical support system. It consists of joystick, patient support system, fixation target, mechanical coupling system. First, we are going to see about the observation system. Observation system is basically act as a compound microscope. It consists of eyepiece lenses, objective lenses, and prisms. Here, the image from the objective lenses are inverted, and it is re-inverted by the prisms to form a final magnified erect image at the eyepiece. And this system has a long working distance, which enables to form an enlarged image of a nearby object. Magnification system is a part of the observation system. Basically, it has objective lenses of magnification ranging from 6x to 40x. And the magnification system has three types of principles. First being Chap's skioscope with a rotating objective, Littmann-Galilean telescopic principle, and the zoom system. Coming to the Chap's skioscope with a rotating objective, it is an ancient and most frequently used magnification principle, and it consists of different objectives, hence gives different magnification. It has a turret type of arrangement. You can see a tank here. This is the turret part, and it moves like this. In the Hag-Street microscope, when you are changing the magnification, it moves similar to that. So that is the turret type of arrangement. This. And we can rapidly change the magnification during examination, and this principle is incorporated in Hackstreet, Bosch and Lohmann, Thorpe models. Next, coming to the Littmann-Galilean telescopic principle, it was introduced by Littmann in 1950. It consists of objective and eyepiece lenses, and Littmann has introduced the Galilean telescope inside between the objective and eyepiece, which consists of positive lens, negative lens, relay lens, and prism erector. And this principle is known as Galilean telescopic principle. And the objective and eyepiece are not changed during examination. It provides a range of magnification by a factor of 5. So the magnification starts from 5x, 10x, like that. And it is incorporated in C's type and American optical slit lamp. Next is the zoom system with a variable degree of modification of the magnification, and the zoom system is employed within the objective. And the range of magnification is from 7x to 35x. It is introduced into the Nikon slit lamp. Next, coming to the illumination system, we have two types of illumination system. First one being Gull-Strand illumination system, which consists of condensers, variable width slit, height control, filters, projection lens to form a good section or a good image of the eye which is being examined. Here in Gull-Strand illumination system, it forms a bright, diffusely illuminated, fine focused slit of light, and the slit widths are, the apertures are 2 mm and 0.5 mm. Next, coming to Kohler's illumination system, this is employed in the latest slit lamps, modern slit lamps. Here it has a variable slit aperture and short focal length of lens, and the image formed is regular, and it is better illuminated than the Gull-Strand illumination system. Mechanical support system consists of the joystick for to and fro movement of the slit lamp. Then the patient support system, which consists of a headrest, chin rest, and the lateral canthus indicator. Fixation target in the slit lamp provides the examiner for examining in certain difficult scenarios. And coming to the mechanical coupling system, this allows the illumination system and the microscopic or observation system to be aligned in their plane, so that when you are shining the, when the illumination is being shown into a target or into the eye, you can see, you can perceive that image of the eye. So this coupling allows a better illumination and better magnified image. Adjustments, we have 3 types. Patient adjustment. Patient have to be comfortably positioned in the chair. Instrument adjustment, and we also ourselves have to be comfortably positioned opposite to the patient. Instrument adjustment, the height of the table, the chair have to be adjusted accordingly. Then slit lamp examination is basically done in a semi-dark room. We have to take care of the illumination, magnification, the slit beam, height, width, if any filters are used, if a diffuser is used, all these have to be taken care of. Coming to the illumination techniques of slit lamp is basically based on parfocality. That is, you are seeing the image which is being illuminated. That if you are illuminating a particular site, that image of that particular site you are seeing, you are viewing. So that is parfocality. And we have direct illumination, indirect illumination, and special illumination techniques. Direct, we have diffused, direct focal, which consists of parallel-piped, optical section, conical beam. Indirect consists of retro-illumination from the iris, fundus, sclerotic scatter, specular reflection. Special illumination techniques consist of tangential, sclerotic scatter, oscillatory beam of Keppe or Cope. Then two other laws are also being used in two different techniques. First is the Snell's law, which is utilized in the specular reflection so that we are able to visualize the endothelial cells. Next is the total internal reflection, which is employed in the sclerotic scatter. So we are able to appreciate a normal cornea or a cornea with the opacity. As the light travels through the opaque sclera and it gets reflected along the layers of the cornea. So if it is a normal cornea, we will see a temporal halo. And if it is a opaque cornea, we are able to delineate the opacity due to total internal reflection. So these are the various types of illumination. With the, you can see this is the diffuse illumination and observation and illumination. Here an angle is formed. This is the illumination angle. And it ranges from 30 to 45 degree, 30 to 60 degree, 90 degree, 0, like that it goes. And we have beam, like beam height, beam width, and magnification. Beam height and beam width are adjusted by means of a knob which is present on the slit lamp. Magnification also. We have three different types: low magnification, medium, and high. Low ranges from 6x to 10x, medium from 10x to 16x, and high from 16x to 40x. So these are the pictures of various types of illumination, beginning with diffuse. This is the direct illumination, focal illumination. This is after staining with fluorescein. Here an optical section is made of the lens, and this is the specular reflection. And here you will see the endothelial cells, indirect illumination or proximal illumination. And here is the sclerotic scatter. Next is the retro illumination from iris. This is the retro illumination or indirect illumination from the lens. This is the fundus examination. Again, iris transillumination. Slit lamp can be used for specialized examination for diagnostic as well as for therapeutic purposes. So diagnostic, it can be fluorescent staining, applanation tonometry, gonioscopy, Tyndall phenomenon in case of anterior chamber cells, Van Her grading for anterior chamber depth, fundus evaluation. And in case of therapeutic purposes, it is used for YAG-PI, YAG capsulotomy for delivery of lasers and in surgeries like that. Next, coming to the filters, basically all the slit lamps have cobalt blue and red-free filters. Along with that, they have neutral density filters, heat absorbing, gray filter, yellow filter, and a diffuser. And they are represented by the symbols amongst the slit lamp, where it is found on the top along the beam width, where you are adjusting the beam width or beam height. You can find the filters being, the symbols of the filters being given. And cobalt blue is a blue filled circle, and it enhances the view of the fluorescent dye in the tear film of the eye. It is used for fluorescent staining and Goldman tonometry. Red free or a green filter is green filled circle, and it is used to enhance the view of blood vessels and hemorrhages. Neutral density is a circle with hashed lines, and it decreases the maximum brightness for photosensitive patients. Heat absorbing filter, it is built into most of the slit lamps. It decreases the patient discomfort. Gray filter is a circle with a thick line, decreases the maximum brightness for photosensitive patients. Yellow filter, yellow filled circle, it is located in the observation system. It is for good contrast enhancement when using fluorescent and the cobalt blue filter. Diffuser, it may be a flip up, filter placed on the illumination source. As we have taken slit lamp photos, we use the diffuser used for general overall observation of the eye and adnexa. These are my references. Thank you.